Item number 6, Community Service Organization reports 6A update on COVID-19.
Good morning, Commissioners. Susan Wheelan, Public Health Director for El Paso County. Good to see you so soon. It's been about 5 days since our last presentation. I wanted to kind of do a recap of our last presentation briefly. That last week on Thursday, we shared some encouraging news which demonstrated through the hard work the citizens, from the citizens of El Paso County staying home and social distancing, were making a big difference in El Paso County. We've achieved decreasing trends in the number of cases and hospitalizations. We continue to work on disease control through increased contact tracing and maintaining increased testing capacity. We also mentioned through Dirk Draper, the President and CEO of Economic Development, that we formed a council over the last few weeks. And our shared goal is the health of the community and the health of the economy. We continue to be careful as we approach, and we also want to accelerate recovery and open more businesses in a thoughtful manner. That is our shared goal, but we want to do it carefully, and we also want to do it in partnership with our hospitals. I think that that is very important, as you have all mentioned here today, to accelerate the opening. We're on board with that. Protect public safety, and how we need to go about doing that, and also, different ideas around what that looks like. I want to make it very clear that as the public health director, we will do all that we can to accelerate opening businesses in a careful manner and in partnership with our hospitals, because they also have been given the authority to approve the variances and the plans. And I think you mentioned it earlier, Commissioner Waller, that there's not consensus on this topic. There's not 100% consensus that let's open the businesses or let's not open the businesses. So the best that we can do is to continue being driven by science and data as we approach this with our other partners who have expertise in the economics and the other areas that are so important to the health of our community. And so you have my commitment in doing that, because we do have some shared goals. And I greatly appreciate your leadership through all of this. We have been in this for about 2 months, and it's going to be a while until we get out. However, we're in a really great place. We're poised much better than most populated counties or large metropolitan areas. So we are in a very good place. I want to also let you know that when we talk about helping businesses and the public health order, we have received numerous public health orders and numerous amendments to the public health order. And our job is to implement those public health orders that are from the state health department. We have our environmental health inspectors. They know normally on their routine duties, they inspect restaurants, they inspect pools, spas, childcare, body art. Those are our routine activities. Since late March, they have also been asked to take on additional duties of interpreting the public health order, educating about the public health order, and also enforcing in compliance. And you'll hear from Ms. Segal, our county attorney who represents public health after me. However, I used to have maybe a handful of conversations with her. I have multiple conversations with her because we have to do a lot of interpretations and figure out what our direction is for El Paso County, and we don't take that lightly. You had mentioned enforcement. That is a last resort in El Paso County. What our attitude is that we want to provide education to the businesses, and we want to be helpful. And I will tell you, the vast majority, they want that as well. And so I want to just share some numbers with you. So the stay-at-home order, when that came out in March, and March 26th, we started taking an increased call number. So since March 26th, we've received 2,700 calls. They're primarily focusing on retail food establishments. 276 of those calls we followed up on, and 103 were non-compliant. Then, with our education and following up, 20 of those were not compliant after we provided education, and then that was reduced to 11. We've issued 5 notice of determinations and only 1 cease and desist order. And the cease and desist order, when we're working together, they are doing the right thing and voluntarily either closing, but then also they work with us on guidance so we can be poised for the future as to when they do open. One of our top priorities to reopen in a limited fashion are the restaurants. We have a great relationships with our Pikes Peak chapter of the Restaurant Association, and we have always been in contact with them. Anytime a public health order comes out, we are in good communication with them, trying to provide the guidance. Now we need to escalate that and determine, what that looks like for the future, and having them open in a limited fashion. And we are receiving a lot of positive feedback about that. So you have my commitment with that, and our medical directors will talk a little bit more about that timing and what that looks like later. There has been a lot of confusion over the public health orders. There's been a lot of confusion over which counties are doing what. I even believed one of the counties, when you say open for businesses, it means the whole county is open for business. But what the devil is in the details. So you look at the details, and it's a step down limited fashion. So our attorney will provide a overview, high level, of what the public health order is and is not. We will provide some comparisons to different counties. One thing I think we need to keep in mind, El Paso County is the most populous county in Colorado. I believe that that's going to ring true when we have the consensus. We're always competing with Denver. If you look what is happening along the Front Range, Adams, Arapahoe, Denver, Boulder, they all have stricter public health orders. We do not. However, we have a dense population, and we have a great number of population. And I want to celebrate what we've accomplished. And when I say we've accomplished, it's the leadership in El Paso County, it's all of the municipalities and their councils, and most importantly, the citizens. They have gotten us to this point. We need to be thoughtful and careful and measured as to how we are stepping down and easing the restrictions, but you have our commitment that we will move as quickly as possible to accelerate opening in that fashion. Ms. Sego, please come up, and she will give an overview of the public health orders, and then also our medical directors will share a request with you to approve a variance so we can have high school graduations, not traditionally, but in a different manner. And I think that that's very important. It's a big milestone, and that is something that I think will hopefully make some of the seniors, and mental health is public health, and I think that that's part of it too. So thank you.
Do we have any questions before you go? Do we have any questions for Director Wheelan? Thank you.
Good morning, Commissioners. Lori Sego, Senior Assistant County Attorney and Counsel to Public Health. Can I get the other presentation, please, Blake? As Ms. Wheelan stated, I do want to provide to you this morning just a brief overview of the current Colorado stay-at-home order as issued by the Colorado Department of Health and Environment. Public Health and Environment, excuse me. So since community spread was first detected in Colorado in about mid-March, a number of orders have been issued from the state. Some of them have since been repealed, some have since been amended, and some have been added. The current safer at home order was issued on April 27th, which was last Monday. It's already been amended once. Amendments came out yesterday. They were minor in nature. But again, we're working on the amended order as of today. It did replace what at the time were Public Health Orders 20-22, which was the first order that closed the bars, the restaurants, the casinos, the horse tracks, and then 2024 was our stay-at-home order. The stay-at-home order first went into place March 22nd, and it expired April 26th. For those who are not familiar with the process, usually what happens is the governor holds press conference, as Commissioner Waller has previously identified. He thereby lets the state, including all of the local public health officials, know what's coming, and then later that day or the next day, an executive order is issued, which is then followed up with an actual public health order issued by CDPHE. Today, as I said, I'm going to focus on the stay-at-home order and just provide you with a brief overview of the provisions contained therein. But I did want to compare that to where we were under the stay-at-home order that, again, was in place for a month. So under the stay-at-home order, individuals were prohibited. The order prohibited individuals from leaving their residence unless they were to engage in a necessary activity. Necessary activities is a term that was defined in that order, and it included engaging in tasks that were essential to the health and safety of your household, taking your dog for a walk, for example, obtaining necessary services and supplies for your household, such as food and medical care. You could engage in outdoor activity with members of your household, and you could go to work at a critical business or at a critical government function. And again, those terms were defined by the order. All gatherings, regardless of size and regardless of ability to comply with social distancing, were prohibited under the stay-at-home order. Also under the stay-at-home order, as I stated, only critical businesses and critical government functions could continue in-person work, so having people actually report into the work site. Once you were at the work site, you had to comply with social distancing requirements as set forth in the order. There were 13 categories of critical business that were specifically defined, and if you did not fall into one of those categories or you were not specifically identified in the order, you could not be opened for in-person work. You had to be primarily engaged in one of the commercial, manufacturing, or service activities listed in the order, and those included things like healthcare, critical infrastructure and critical manufacturing, critical retail and critical services, and construction. Restaurants and bars were allowed to open only for the purpose of providing delivery or curbside pickup. Compare that to where we are now under the Safer at Home order. Rather than being prohibited from leaving our homes, individuals in Colorado are now encouraged to stay home as much as possible and avoid unnecessary interactions. You are urged to wear a cloth face covering over your nose and mouth whenever you leave your residence or your property. You are allowed to engage in gatherings in public or in private up to 10 people. Vulnerable individuals, so those over 65 or those with underlying health conditions, are urged to stay home except to seek medical care. And employers are prohibited from compelling vulnerable individuals to perform in-person work. If you're sick, you are required to stay home except to seek medical care. So under the Safer at Home order, much of what was prohibited for individuals has now become a strong recommendation. Recreation is a big topic for many people. And under Safer at Home, outdoor recreation is allowed up to groups of 10. You must practice social distancing, so you must try to keep 6 feet apart at all times, whether you're engaging in tennis or hiking or biking or running. Travel for recreation should be limited to your own county or to about a 10-mile radius. Gyms are closed. This has been a big topic for us in the last week. Gyms are closed, except that they may hold classes or personal training sessions in limited groups. Those groups are limited to members of your household or a mixed group of 4. And you can't share equipment if you're engaging in these classes or personal training sessions unless you're in the same household. According to CDPHE, team sports are not allowed and campgrounds are closed. In addition, tennis courts and golf courses are open so long as no equipment is shared, social distancing is practiced, and group sizes are limited. Examples of other recreation facilities that are closed include ski lifts, playgrounds, indoor skating rinks, pools, and hot springs. Outdoor gun ranges are open, indoor gun ranges are still closed. So with respect to business, the order itself provided for a phased opening approach, and there were certain dates listed in the order for certain sectors of business to reopen in a limited fashion. Last Monday, on April 27th, critical business and critical government functions, as had been defined under our stay-at-home order, were allowed to continue. Field services were allowed to resume. Field services are defined as those services that are provided out in the field, as opposed to on the company's own property, and that includes services provided at third-party private properties. They include things like landscaping, lawn care, handyman services, house cleaning, architectural and engineering services provided out in the field, and private investigators. Also last Monday, services that are performed in limited healthcare settings were allowed to open. Those are locations where certain healthcare services are provided as enumerated in the order. They include things like acupuncture, chiropractic services, and occupational and physical therapy. Also last Monday, non-critical retail, according to the state order, could offer curbside, drive-through, or drive-up service. As has been previously mentioned in these presentations, prior to the Safer at Home order, El Paso County had already interpreted the provisions of the stay-at-home order to allow such curbside or delivery service from non-critical retail, and some of that had been occurring in this county. On May 1st, last Friday, non-critical retail was allowed to resume in-person services at a 50% capacity. In addition, last Friday, personal services were allowed to resume. These are services and products that are not necessary to maintain an individual's health or safety or to maintain the sanitation or essential operation of a business or residence. They include things like dog grooming, body art, manicures and pedicures, massage therapists, hairstylers, barbers, tailors, and tanning salons. For personal services, I just wanted to call out a particular requirement for those, and that is that in a single location, they are limited to having 10 people in that location total or a 50% occupancy rate, whichever is lower. So if you have 10 stylists' chairs in a particular facility, you're allowed to have 5 customers and 5 stylists servicing those customers. That is your maximum. So yesterday, on May 4th, non-critical office-based businesses were allowed to open up to in-person employees coming in, up to 50% of their employees, to resume their in-person work. One of the amendments to the order that was just issued yesterday also added non-critical manufacturing. They are allowed to reopen with no more than 10 employees on site. I did want to take a moment to just briefly go over some of the other counties that are doing things a little bit differently than what the Safer at Home order provides. Eagle County, before Safer at Home was issued, did receive a waiver from the governor's office, and under that waiver, much of what they had asked for actually was covered under Safer at Home when Safer at Home was actually issued. So they just got ahead of the game by a week to 10 days. But a couple of differences that still stand today are that in Eagle County, campgrounds and picnic areas are open, and they do have a limited opening of non-critical businesses, but restaurants and bars are still closed, and no more than 10 total employees and customers are allowed in those non-critical businesses. There are limited exceptions to that as well. In Mesa County, over in Grand Junction, we've heard a lot about them. They did receive a waiver from the state under the Safer at Home order. I do think it's important to note that at the time that they requested their waiver, they had only 39 cases of COVID, and this was a week ago Monday on April 27th. They had 39 cases and no deaths. But their waiver did allow for the opening of restaurants and fitness centers up to 30% fire code capacity. Places of worship are also allowed to be open and provide services up to 50 participants. Contrast that with the Denver metro area, the more urban and densely populated areas just north of us. The counties listed on the slides have continued their own countywide stay-at-home orders until this Friday, May 8th. Pitkin County, which is Aspen, also has a stricter stay-at-home order, which is in place until Saturday, May 9th. This helpful graphic was provided by Colorado Counties Incorporated, and it shows you which, as of yesterday, which counties are following the state's Safer at Home approach under the state order. It shows you the counties that have more restrictive local public health orders in place. It shows you those counties that have requested but are still pending a state waiver of the Safer at Home restrictions, the 2 counties that have actually received state exemptions, and then those whose status is unknown. Under Safer at Home, businesses that are have been allowed to open have a number of requirements that they must comply with in order to resume their operations. Those relate to disease mitigation in the physical workplace itself, disease mitigation for their employees and for their customers. They include criteria such as social distancing, maintaining that 6-foot separation between people, frequent disinfectant, signage for both employees and customers, employee and customer symptom screening, and mask and glove requirements. Each of these and the additional criteria that I haven't mentioned vary from sector to sector. Public Health does recommend that citizens be aware that these requirements are in place for these businesses. And so we would ask the public to comply with any requests that are made of them when they frequent these businesses, because again, it does vary by sector. And so the requirement when you go to the grocery store is going to be different from the requirement when you go get a massage. And so because these businesses are required to ask these things of you, we are asking the public's cooperation for that. When businesses are struggling to figure out, can I open? Under what circumstances can I open? What do I need to do? We ask them to first look at which category your business fits in. So if your business is not specifically permitted to be open, you can't open. Even if you are completely able to comply with all of the social distancing, disinfecting, protective equipment requirements, if the order doesn't allow you to open, you're not allowed to be open at this time. In addition, for businesses, it's important to note that the business-specific requirements regarding occupancy and limits on personnel take precedence over that general limitation that I mentioned earlier on for individuals of gatherings no more than 10. So many businesses are allowed to have more than 10 people at their site, such as retail and office-based businesses. Some, however, such as personal care, are limited to 10. So again, the business-specific requirements take precedence over that general limit on gatherings. That's all I have for you today, Commissioners. I would just like to share with the public that, and our business community, that if they have questions about this public health order, or if they have concerns about a possible violation, here's a number that they can call. This is our environmental health call center. They're taking calls all day, every day. Everyone gets a response. Everyone gets a conversation and education about the public health order and how to comply with it.
Questions for Ms. Segal, Commissioner VanderWerf?
Thank you, Ms. Segal, for the great rundown on what the different public health orders mean. I think that's so important that that get put out in the public domain. And while I certainly have my point of view about getting more businesses open, I appreciate that we've got some pieces and parts and components of this on that way. So, that I deeply appreciate. And we've been talking about what to ask for a variance of the governor, and certainly from the dais here, it's been mentioned, restaurants and places of worship. I totally support that. But I do have another question, and that's campgrounds, because it looks like, I didn't know this, that Eagle had requested a waiver for camping, and I'd be interested in understanding more about that. I have a specific request from a campground owner in my district that is absolutely confused why he can't open, because his campground is on 1,000 acres with 200 sites, and there are these other parts of partial openings with other requirements in place and so forth, where the social distancing is at 6 feet, and he can deliver much greater social distancing than that in his campground. So he's baffled. I'll make the point, I think he still has a tough road to hoe to convince people to come to his campsite as well, right? So he's got that challenge as well. So it seems to me like this is maybe something that we ought to consider. He mentioned to me also a lot of other confusing things that baffles him about the order, because he's not just a campground, he's also an RV park, and he's got some of these sites where people are living there. And they've been living there this whole time. So it's actually like a residence for some people. And that's because part of what we had done with regard to tiny home legislation, in December of 17 is that we had removed the requirement that RVs stay in an RV park only 180 days because we couldn't enforce it. So there is no limit to how long an RV can be in an RV park. So you actually have some places that are campgrounds, RV parks, and essentially look like residences for some people. And he just doesn't, it's this mix. This is where we get to this, kind of confusion. So I think I'd like us to consider campgrounds, particularly since Eagle County has made that request as well. I'd like to learn more about what they're doing. One other point with regard to non-essential manufacturing. Again, I'm glad that there is something about that, about opening up non-essential manufacturing. I am baffled by why it should be restricted to 10 employees. Now, to be fair, a lot of those non-essential manufacturing sites, I don't even know how you define non-essential, but that's another story. But for some of those sites, they need more than 10 people to do the manufacturing. So to me, that it should be not as restrictive as that. And I'd like us to consider possibly a waiver that increases that number. I don't know what the right number is. I think if you maintain all the social distancing and what I call the social distancing plus 6 within the manufacturing site, that this number of 10 employees could be addressed as well. And these, of course, are restrictions that have been put in place by the state, and I do believe that there's people that are confused by them because they don't fit necessarily neatly into any one of these categories. And then I'll just make one last point. I do want to thank you and the team for working with the Colorado Springs Dental Society about trying to fight that battle to allow them to open. And as you know, we've realized now that they fall under a different public health order, Public Health Order 29, and there's no variance opportunities in that public health order. So we have to go back to the state and appeal to allow dentists to open up. I think that's really important because some of what they're not being allowed to do is preventative health care that prevent clients from actually getting into worse health care situations. And we need to do what we can to address that kind of thing. So I think we need to continue to advocate for that. And my understanding is that our public health is going to continue to advocate to get the state to relieve that burden a little bit so that we can get more dentist offices open, and I do appreciate that. So campgrounds, number of employees in manufacturing, and continuing the battle for dental offices, plus the other requests for restaurants and places of worship. Thank you.
I appreciate your comments, Commissioner VanderWerf, and Public Health recognizes that these orders are confusing, not clear.
Arbitrary in some cases.
And sometimes conflict with the guidance that's on the CDPHE website itself. So we are doing our best to interpret them as they're written. And again, we are ready and have been helping the business community and employers try to navigate this order as best we can.
All right, I've got a couple questions, but before I get to them, are there any other questions for Ms. Segal? Well, I'll get to mine then. So we've not had great communication as we've discussed with the governor's office on any of this thus far. We oftentimes find out about what he's doing when everybody else does in the press conference. But my understanding is he has laid out a bit of a roadmap for when things are going to be opening up. Can you talk a little bit to that? We've talked about everything he's done to this point, but where are we moving forward? So, for example, has he said anything on in-person dining in restaurants, when he anticipates having the ability to do that, or in any of these other, sorts of businesses that would allow people to come back into them and, engage in activities inside the building in some way? Is there anything out there, anything that he's said regarding that when he anticipates getting back to that point?
Commissioner, I'm not sure that I'm in the best position to answer that question for you. With my current job duties, I just haven't been able to watch all of his press conferences. So in terms of what he has said in those, I am not up to date. I'm pretty familiar with what's going on the CDPHE website, and there is nothing on there that I have seen that is looking forward.
It looks like Ms. Wheelan has maybe has an answer for us that way. Thank you.
I wish I had a specific answer for you, but
Very few specifics in all of this.
I will tell you that news conferences are held. One was held yesterday. I, had some conflicting conference calls that I was not able to tune into the news conference. I did hear about a week or a couple of weeks ago that the governor's target date was May 15th to open restaurants, but then I heard yesterday that it was May 15th or maybe June. So I do think that with the roadmap and some of the unexpectedness as it relates to what's going on in the state of Colorado, we have a better handle of what's going on in El Paso County. And I think that, in working with the Economic Development and Chamber and our hospitals, that due to the restaurants being one of the biggest economic drivers in El Paso County, as well as they have suffered many job losses, that is going to be our top priority to work with that industry. And I do hear all of the different requests as it relates to the different industries, and we'll do our best. It's a challenge, and I think I heard it explained yesterday by a conversation that I was having with another elected official, that we're building that plane while we're flying it, and we're doing the best that we can. And I can assure you that with our public health staff, we've folded over 50% of our staff into the response. So they have altered their routines. We have suspended. We have closed programs. We are still continuing some essential services like the Women's Infant and Children program, or we're doing inspections for plan reviews and septic systems and those types of activities. But I want you to know that we are trying to mount the best response and to be sustainable into the future with contact tracing, identifying hotspots, doing a good job there, and also in coordination with the Pikes Peak Regional Office of Emergency Management. So know that you see less than a handful of public health representatives here today. However, we have many more that are working behind the scenes and doing all that we can. But a specific answer to your question around what does that roadmap look like and what are those target dates, that's a moving target for the state.
With respect to the governor's office?
Yes.
Yeah, so help me understand this, and maybe this is a question for Dr. Kelly later, I'm not sure. But when do we think we'll be ready? When will the Department of Public Health and the hospitals be ready to, in El Paso County, start opening up some of that in-person dining and things of that nature?
Mm-hmm. Well, I'll tell you, over the last few weeks that we've been having conversations with the Economic Development and the Chamber, and there are numerous different partners on there, mm-hmm. and many of them represent the Colorado chapter of the Restaurant Association. So we're not waiting on what the governor plans to do. Our approach is to have a careful approach, to be poised, and to set targets for what we want to open. And so I don't have a specific date, but currently what we're doing is working with our inspectors who have the relationship with the restaurants, and I've had conversations as well, and with economic development, is to put a plan in place and to have guidelines to make that happen as soon as possible in coordination with our hospital. Dr. Johnson is in conversation with our hospitals on a daily basis, and we also have many other conversations related to testing capacity, and healthcare and public health is a shared responsibility. It's an important relationship. We focus on prevention. They focus on treatment. So we're not waiting on the governor to ease up in different areas. However, I will tell you, sometimes we have done a lot of work, and it has been duplicated work. And then there's an announcement that comes, and then we implement. But so that we're doing the best to coordinate that we can.
And I get and understand that frustration. I know we did all this work on graduations, and then blammo, right after all that work gets done, the governor's office comes out with some sort of guidance on graduations that I'm sure we're going to be talking about later. I get and understand that, maybe it's hard to get to a specific date on when we're going to be able to get there, but is there some sort of, a window? Is there anything that we can point to, just to be able to say to the citizens, hey, here is your light at the end of the tunnel. Here's where we think we're going to be. And maybe there isn't one. Maybe it's not possible to get there. Maybe that's something I don't quite understand. I don't know. But is there anything that we can sort of point to say, listen, this is when we think we're going to be able to get back to more normalcy in our lives?
So I'll let Dr. Johnson and Dr. Kelly address that, because that goes to the virus and the incubation period. However, I want to point out that, for El Paso County and the citizens, we've made tremendous strides, and I think that there has not been a lot of celebration about that within the public, because the public health orders are so confusing in many different formats and in the ways in which we receive information, that we are open for business. We have been easing up on the restrictions, and so there is a lot of activity far beyond that stay-at-home order. So we're now at the safer at home, which is only an advisement order. And so there's a lot of activity out there. We'll continue to monitor the disease spread, see what that activity holds, ramp up our contact tracing so we can make sure that we're stopping and limiting and having a well-oiled machine there. And I will say that we've got a tremendous amount of expertise within our epidemiologists. We've had a handful of staff prior to this COVID. We're incorporating the Medical Reserve Corps. We've incorporated the coroner's investigators. We've incorporated 35 nursing students to help us out with contact tracing. So all of those areas that we're going to maintain while we're not waiting for the governor to make an announcement. We're creating action plans with our partners and with our hospitals, so we're poised and ready to loosen up those restrictions even more. To your specific question, I will ask Dr. Kelly and Dr. Johnson to touch on the incubation period, but no, just because there's an incubation period, it doesn't put us on hold as it relates to working with our communities and our leaders to put forth action plans to be poised and ready to go.
Thank you for that. And obviously, in a very difficult situation here, this is, stuff that people have never dealt with before. It's very difficult, I understand, to figure all that out, and I apologize if but I'm just trying to get some clarity and some understanding. One last question for you. Obviously, we all want to get moving as soon as possible, just like you do. What can we do? What resources can this Board of County Commissioners provide to you? And maybe there aren't any. Maybe it is just waiting on incubation periods and things of that nature. I don't know. But are there some sort of resources we can provide to you to help accelerate the process in some way?
Well, I think that you all are heavily connected in the community, and part of that is gaining some expertise from those who you speak with. And I would encourage you to engage in the planning process and the details of those plans, so you're fully aware and know what those details are as we work together to implement these action plans, because this is very complex. It's not as easy as flipping on a light switch and turning it off. There's so many different components and impacts to our community. I greatly care about our community. I grew up here pretty much after my dad retired here, elementary, junior high, high school, college. And I can tell you that we don't take these decisions lightly. When some members of the public are issuing complaints and asking us to bring down the hammer on some of the places that are out of compliance, we're trying to educate them first, because I have compassion for the businesses that their livelihoods are at stake. They're laying off their employees, and so we don't take that lightly. So we're focused on education, and we will do everything that we can where we can, because the health of the community is not only about limiting and stopping the disease spread, it is about the economy, because that's what it keeps people healthy. But it's going to depend on how we do that in a thoughtful, careful manner, as we have never dealt with this novel disease before. We are all figuring it out. So I would encourage you all to get engaged more so with the process and the planning as we move forward and continue to do the right thing for our county. That's what I would ask.
Thank you. Anything else? Commissioner VanderWerf.
Thank you, Mr. Chair. I actually would like to follow up with something that Commissioner Waller, I believe, eloquently stated, and that is, and I think you alluded to it, Susan, as well, or at least you certainly glanced over at me when it was mentioned, and that's the contact tracing. Several weeks ago, you all sold me on the value of that idea. I'm definitely interested in that. I see it as a huge, effective device to get us to an accelerated opening of the economy, something faster to one degree or another than what the state seems to be allowing to us. And by the way, I do believe there is confusion, and I don't believe the governor has really brought out any concepts about how to open up these other non-essential business industry components. I think that's a problem and leaves for a lot of confusion as well. But as we accelerate the opening, hopefully as quickly as possible, maybe faster than what the governor seems to be willing to do. Contact tracing, in my mind, is an essential component of us getting there to do that, because it gets to this concept of allowing a broader reopening, but then if that behavior produces an outbreak, we contact trace that, and we close down that little piece of the economy, everybody that was in contact with. So you get a broader opening of thousands of people, but you might close down a 200-person piece of the economy, and the contact tracing is the device that allows us to go there. Why I bring this up? It comes to the request from the chair is to whether or not you have enough people. If we can get to that, do we have enough people to do contact tracing? Because you and I had some conversations, and that's a challenging part of the work that you do, because that's a ton of phone calls, calling a lot of people, and you don't necessarily, I don't think anyway, you could correct me if I'm wrong, I don't think you have to have doctors necessarily making those calls to find out who somebody's been in contact with. So that could be a piece of augmenting your staff, is to get to a more aggressive posture. I'm not saying you don't have aggressive, because you have an aggressive posture, but to get to a more aggressive posture with regard to contact tracing, which becomes an effective device to allow for faster reopening. So I'll ask you to comment to that. Is that a place where you could use some help from the commissioners?
Sure. Let me back up a little bit with that and take the opportunity to say that, public health is about epidemiology. 24/7, we monitor over 60 different diseases in the community. That is our niche. No one else in the community does that. We have a lot of expertise with our epidemiologists, and it's because of our epidemiologists and our disease intervention specialists and the operation that we have mounted. That's a key piece of why we are so successful, because we have been doing numerous contact tracing, hundreds, and it is extremely time intensive. We have epidemiologists, we have disease intervention specialists, and we also guide that by our medical directors' input. All throughout this emergency, the guidance, even from the medical standpoint, whether it's testing or different requirements, that's been changing all along the way, because this is a novel virus. So we're learning a lot as we go. But I did want to mention with the contact tracing, the epidemiologists and their expertise, that's a key piece of why we are here. To your question about being more aggressive, that's what we've have been gearing up to be. The key is going to be sustainability, and I would encourage you, and maybe we can do another presentation about what we currently have with epidemiologists and how we are doing and what that future looks like. We're using a lot of volunteers. The Medical Reserve Corps, Dr. Kelly's staff, that's not sustainable, or the 35 nursing students that we have worked with on the hepatitis A outbreak, and we're greatly successful there. So we have the expertise, we know what we're doing, we need to maintain capacity, yes, we need to be more aggressive, and sustain that as we move along.
Any other questions for Director Wheelan? And Sina, well, thank you for all you're doing. I know it's frustrating, and it's hard, and it's difficult, but this is why we have great people in the places we do to make sure we're getting through it the best way we can. So thank you.
Thank you, Commissioner Wheelan. Appreciate it.
Dr. Kelly?
Thank you, County Commissioners. My voice is going a little bit. It's been a lot of really late nights, so I apologize for that. So I'm here to update everybody on what we're doing. Mostly what I'm going to do is recap what we talked about last week, but a couple of things we need to make sure are clear. First, I'm not the director of the Public Health Department. Many media outlets continue to call me that, and I'm not. I'm the elected El Paso County Coroner. My time here at the El Paso County Public Health Department is as a volunteer. The person who you just spoke to, obviously, is the director of the Public Health Department. She's really the reason why I'm here helping. Susan Wheelan has been an incredible leader throughout this. There are a few things in any of our lifetimes that are going to be more difficult to deal with than what we are doing now. It's because of her leadership, her vision, her ability to bring diverse and vast groups of people to the table is the reason why we have been thus very, very successful. And so she doesn't get a lot of the credit because she's always thanking everybody else. But the reality is we wouldn't have accomplished what we've accomplished without her. And she's really the key to our success moving forward. So to recap a little bit last week, just to make sure we got the big points. This is our COVID-19 response goals that we have met, which allowed us to reopen into the safer at home phase, which Ms. Hugo talked about quite extensively. And from the beginning, what was our goal? Our goal was to reduce the rate of COVID-19 virus spread to save lives while preserving our healthcare infrastructure. And we have succeeded in those goals throughout. And how do we do that? Once again, through our containment strategies with Commissioner VanderWerf discussed, our contact tracing and all those things. Our mitigation, which was those broad efforts, the social distancing, the stay-at-home order, those kinds of things. And then lastly, our capacity building. And as described by the White House and President Trump's staged approach to reopening America, as well as guidance by the CDC, as well as guidance by Colorado Department of Public Health and Environment, as well as the governor, and as well as really every public health entity in the world. The goals to get to the point where you could start to reopen things were the four things that we have here, okay, that are listed. First, to reopen, to begin the recovery process, you need sustained decrease in new COVID-19 cases and hospitalizations greater than 14 days. And I showed the data last week. We're not going to go through it again, which showed our new cases having a downward trend really since the end of March into April. We've talked about the problem with just using new cases as your metric, because really if your goal is to preserve the healthcare infrastructure, it's really that communication with the hospital about what their capacity is that should be able to drive the rate at which you reopen. And that's really a lot of what we're doing is having those relationships, having those daily conversations with the hospitals. And we have met that goal. We have been downward trending in both hospitalizations and new cases over the course of the last month while increasing our testing capacity, which is number 2. This is the second thing you need to do to begin opening things back up. Increased testing capacity. The gold standard across the country is 152 tests per 100,000 people, which for El Paso County, that's a little over 1,100 tests a day. We currently meet or exceed that capacity for testing because of work with our partners like UC Health, Peak Vista, the various clinics and other hospitals around town. Early on, we required assistance from FEMA to stand up one of those units. We currently are doing all of that testing with local resources through our healthcare partners. So we have met that criteria. You will see in the national media lots of criticism towards governors who are opening back up who have not met these criteria. Our own governor, Polis, is in many ways taking a beating in the national media because he's opening when Colorado across the board does not yet meet some of these. In El Paso County, we do meet these things. Okay, number 3. Increased contact tracing, which we've talked quite a bit about just now. That allows us to transition once again from those broader strategies, those mitigation strategies, which have a lot of the negative effects on our economy and our social interactions with one another, towards a more focused approach, which is really where we need to go from here. We have built that capacity from the very beginning, initially with surge and flexing of staff from other departments, including my own coroner's office, to now building up more permanent positions. But as we move forward in this is going to be the area, as Commissioner VanderWerf pointed out, where we're going to have to continue to add resources to. Because as we all know, this is a long road. And as we travel through summer, there may be, as we've always suspected, some seasonality to this, meaning the numbers may fall in the summer, but they may resurge in the fall. That's okay, as long as we have the capacity and the testing and the contact tracing to deal with it. So just because we look great today doesn't mean it's time to stop building some of this for the future, because that's what's going to allow us to continue moving forward, as opposed to having to contract back down, which obviously none of us want to do. That would be incredibly devastating to not only our morale as a community, but also to our economy. So where we are today, we are in great shape with the burden of cases we have, with the contact tracing capacity that where we are now. So we're in very good shape. So we've checked that third box. The fourth box, increase hospital capacity to allow for treatment of COVID-19 and non-COVID patients with non-crisis protocols. And many states, including our own, have previously passed crisis protocols, allowing us to treat individuals at standards lower than what you normally would. It's sort of like a version of combat medicine. You do what you can with what you've got. You need to be able to care for the people that you have sick in good standards and that we normally practice under. And in our daily conversations with our hospital partners, UC Health, the Centura system, as well as Children's, we are in excellent shape with how their staffing is, how their PPE is, and all of those things. So we are in great shape in the fourth category. Now, what's important to know about the hospitals is hospitals don't operate in a silo. Okay, these are hospital systems. And so what's happening at UC Health in Colorado Springs is affected by what's happening at UC Health in Denver and other places. They share PPE, they share staffing, they share ventilators, they share all of these things up and down, which allows them to be flexible. All right. So what happens if we have another part of the state who's not doing well, who has increasing testing cases, requires additional testing, requires additional staffing and PPE, that may draw away from our community some of those resources. This is an example. We talk a lot about personal responsibility. Personal responsibility doesn't mean I get to do whatever I want without consequences. It means if I do what I'm supposed to do and you do what you're supposed to do, we're going to be okay. But the reality is if some people don't do what they're supposed to do, and some communities aren't good at this, it can ultimately hinder our ability to move forward. And so we truly are, it's a catchphrase, but we truly are in this all together. And so our hospitals have to keep one eye on kind of what we're doing and one eye on what's going on around the state. And so we need all the communities to be in this with us. All right, so Ms. Segal went through a lot of this about what's open, what's not open, and why. And so here's the things that have either always been open or open now. Limited criminal justice. The courts come back usually beginning of June. Recreation, shopping, grocery, retail, restaurants for carry-out, and those things. Our elective procedures are now back. Our grooming, which obviously for me wasn't a big deal, but for others, getting a haircut was a big deal. They've gone a long time without it. And so our agriculture, our parks, our construction, our elective dental procedures, which we know there's some problems there that we're working through. Childcare, transportation, obviously all the things that we love about Colorado outdoors. And then the big one is our in-office companies, our workforce that runs in an office. All of those things are obviously not open with guidance. So what's not open? Not yet. Sporting events, in-class instruction, theaters and concerts, nightclubs, in-person dining, in-person indoors, large audience religious services, in-person casinos, indoor shared space commercial gyms, and spas. Now, what every single one of these things has in common, with the exception of spas, is that they involve large groups. You can't do these businesses without having large groups of people. And as we've talked previously, I think the first briefing I gave, our ability to control the virus is largely dependent on the virus itself, how quickly it can be transmitted, but also the number of contacts that a sick person has. And in smaller groups, we can control it, even if the virus spreads, through our contact tracing, through our adequate testing. We can identify that sick individual, get to the people that they've had contact with, and control the virus in a much more localized strike team scenario. I gave in the example of the South Korean church. South Korea had it all under control for the first month and a half of the outbreak. One person became a super spreader at a large religious ceremony, and over the next few weeks, it just massively exploded, and they completely lost control. That has huge ramifications, not only to the healthcare structure and infrastructure, but the economy, right? Those are the things that we're trying to prevent to allow us to keep control of this. Now, as we've worked through this, one of the things I think has been voiced over and over and over again is the frustration with being provided orders that are difficult to interpret, that we didn't have any say in the crafting of those, that we felt didn't have real-life work-throughs with the industries themselves, right? It's just a piece of paper with words, and then we spend at Public Health the vast majority of our energy trying to interpret those and then help businesses and individuals through that. We felt we needed to take a different approach locally. We're not going to turn around and do the exact same thing that has frustrated us. So from the beginning of this, our focus has not been on telling businesses what they can't do, but rather working with them to tell them what they can do and the ways that are medically sound. And that's what we've been doing. With our restaurants, we worked with them right out of the gate to make sure those pickups and deliveries were sound, and we could work with that. The last couple of weeks, last week, and then including this week, Dr. Johnson is working with our churches locally. One of the things we were able to do was to interpret those health orders to say, we understand we can't have large groups of people, but what we can do is have drive-up religious services or drive-in type services where the minister can give that sermon to a group of people in a way that's very safe. And we've been able to provide that to our religious community. Our religious community from the very beginning of this has been incredibly supportive, incredibly thoughtful, very creative in how they've continued to provide that service to our community, which is critical for our mental and spiritual well-being of our citizens, and they've done it with us, which is really the way that we need to do, and we're going to continue to work through that. The libraries is another one that I've been working with from the beginning. The libraries are still in the order. They're closed. We've been working with them to get their guidance and everything up to where it needs to be so that when they do begin to open, they are going to be successful. As our citizens now go back into the workforce and have to look for jobs, now with economic hardships, their ability to go there and use computers and get access to resources is going to be critical for those things. And so there's ways that we can do that and still be super successful. We are meeting with, Dr. Johnson's meeting with churches and the mayor, I think on Thursday of this week, continue those conversations. We are in constant conversation, and we will have a large meeting today with our restaurant groups to talk through what their process towards a reopening looks like. We want to get to the point where when we're ready to go, we can pull the trigger. We're not necessarily waiting on the governor to decide when that's going to happen. If the governor's timeline is the same as ours, great. That means the rest of Colorado is doing wonderful. We're doing wonderful. But what we don't want to have happen is us to be the point where we feel good about it, public health, the restaurants are ready to rock and roll, and the hospitals are good with it, and we're being held back because other parts of Colorado aren't there yet. We are going to proceed through this at the rate at which El Paso County and our partners are comfortable with, and at the point that we have that, we will be bringing it to you. As far as timeline goes, the governor made a comment, May 15th was sort of the original target, and now he's walked that back, May 15th maybe to early June. I think when our conversations with restaurants, and public health, I think that the middle to the second half of May would be completely reasonable. We don't want to not open businesses if we're ready to go, but on a practical level, When we open things, when we move forward before the governor provides the orders, it's not just orders, it's recommendations, it's guidelines. And as we open things before that, that means our local public health department has to be engaged with those partners so that when we decide what works for the staff, the customers, and the business owner, it's with their informed, they know how to run their businesses better than we do. We know how to prevent people from getting sick. You can't make this work without bringing those two groups together. And so a lot of our efforts on a daily basis is spent engaging with those partners. And when they're ready to go and we're ready to go, and the hospitals say, we've got enough data here, how this virus is doing after we've already opened up all of this other stuff, we'll be ready to pull the trigger on that. But we are never going to do anything that we feel puts in jeopardy the long-term health and the long-term economic viability of our community. Because it isn't just about getting things open now, it's about getting things open permanently and successfully so that we can continue progressing. It does us no good to open businesses that aren't ready to go if we haven't provided them the guidance, the support that they need to make the business owner, the staff, and the customer confident that we're doing this the right way, which speaks to Commissioner Waller's point that there are a lot of folks who think we're going too fast because they see that in other places. And I'm here to tell you that we opened into Safer at Home just the time we should have done it because we were ready to go, and we'll continue to work towards getting some of these other things opening on the timeline that's most appropriate. Did you have a question?
No, I was just going to say, so we're thinking probably a couple of weeks. I mean, in that ballpark there somewhere for before public health and the restaurants and the hospitals have something for us to vote on.
I think so. We're meeting with the restaurants today to talk about what that looks like. We've got target dates. Obviously, we want to do it as quick as we can, as safe as we can. The reality is if you take our clerk and recorder as example, Chuck Borman, unarguably, shouldn't say this out loud, the greatest clerk and recorder in the entire state. I've been working with Chuck now for several weeks on how he's preparing to open. But even despite being the greatest clerk and recorder in the state, there's construction that has to happen. There's physical barriers that need to go up. There's restructuring of staff. There's guidance. There's back and forth. All of these take time. And we are on board with our business owners and have been from the beginning. And this is what they're telling us. Work with us. What do you think about this? How does this work for you? That looks great. What about this? All of that takes time. We want to do, this is in a large part a medical decision. In any medical decision, you want to be right. You don't necessarily want to be fast. Because if you're fast and you're not right, it's like all things, you pay more in the long run. And so we're working this timeline as quickly as we can with those partners to make sure everybody's ready to go. The way we're doing it, essentially working with these folks, getting all these systems in place, structures, having it ready to go, going to the hospitals, and Dr. Johnson will speak briefly on this, how we're moving forward to try to be a little bit more efficient. And we say, hospitals, this is our plan. What do you think? Launch or no launch? And if they say launch, like one of the things we're going to talk about today, we go. We bring it to you. You turn it around, assuming you guys all agree with moving forward, which based on your comments today, I suspect you would. And then we send that on to the governor. We're doing it because we've got the data and the guidance in place to do it, not before. Because to do it before does us no good in the long run. So that's kind of where we are with that. And then just to summarize what we're doing. Paso County has successfully entered the Safer at Home recovery phase. We've been able to reopen vast sectors of our economy and community appropriately and with solid medical guidance to ensure businesses, their staff, and their customers are safe to get back to work. This is one of those great truths in life that your dad tells you when you're a teenager and you did a crap job mowing the lawn, and he sits you down and says, son or daughter, there are no shortcuts in life. Any job worth doing is worth doing well. And this is one of those things. We are going to go as fast as we can that's safe and sound and ensures that we're going to be successful. We currently have the testing capacity, hospital capacity, and growing public health capacity to ensure successful containment and treatment of our ongoing COVID-19 viral transmission. If, and this is the huge if, this is where the community comes in. Because at the end of the day, it's not us driving the decision. It's not you driving the decision. It's not even the hospitals driving the decision. It's the community's ability to act in sound ways to stop the spread of the virus. That's what drives this. This remains true to progress through these phases only if our businesses and our community continue to take that personal and shared responsibility and actively and aggressively follow the ongoing guidelines. We are all on the same team here. We're all trying to get to the same place. Some of us may be more frustrated than others, thinking we're moving too fast. Others may be more frustrated, thinking we're moving too soon. But the reality is we're following the data and we're making sound decisions. We need our citizens to continue. They have done amazingly well so far, proven by the data that we have that shows it. Social distancing, wearing face coverings within 6 feet of others, limiting unnecessary social, all of these things are urged. Protecting, this is the big one, protecting those at-risk populations, and we've all talked about that. That's critical. It's not necessarily how many people have the virus, it's who gets the virus, and we need to make sure we're still taking care of those. And most of this just boils down to common sense. If you don't feel good, don't go out. Right? If you've been around somebody who doesn't feel good, don't go out. Take that personal responsibility, which once again means you act in a way that serves the greater good of the community by making good decisions, not by the government telling you that you have to do these things. And that's where we are. These are urgings. These are recommendations that we're asking of people, but we need people to do the right thing. Not because the president said to do it, not because the governor said to do it, not because public health said to do it, not because I said to do it, because it's the right thing to do. It makes sense. We've been successful. That's how we get further down the road. It's sound. We've proven it. Let's continue to do it, and we'll be very, very successful. And our phased approach, if executed as we have done to nearly perfection in this community, gives us our greatest chance at that continued success and sustained economic, social, emotional, and healthcare success. This is the roadmap that we've put in place. We've followed it. We've accomplished every goal that we wanted to. Why would we abandon that approach now, right? We are on the way towards the finish line. It is completely illogical, as I said last week, to abandon the very thing that got us the success that we have now. And so we greatly appreciate all the comments that you all had today in buying in with that approach. I feel like from public health's perspective, we told you what we wanted. We told you the problem. We told you how we were going to fix it. You guys listened and everybody did it, and we've had the success. We've earned the right to continue that course from our perspective, and we're going to do that. Our local commitment and execution.
Can I stop you just real quick? Commissioner Gonzalez.
Thank you, and this is very valuable, and I continue to thank all the great work that's been doing. But as because the last section you talked about was the data telling us driving that, and I understand it, and it was commented on last week that what that means in general. Correct me on that, but in general was like we want to see the data for the reopenings. So the 27th, how does that result? The 1st, and then the 4th to help drive us, and that's what people want to wait on. Well, if that is accurate, we're voting on something today without that exact same data on the graduations. And so my question is, we're voting to approve that. Those conditions are the same for that and whether it's, campgrounds, churches, and restaurants. We're voting on something today without that information, and it sounds like we're being told we're delaying on the others for the exact same information. So that's where I'm a little confused, but that's my feedback right now.
Yeah, and I can explain that. So when we get to the graduations, we'll talk about why the graduations is a very unique, specific situation, and why we in our hospitals feel comfortable, given how we can control it medically, given the real risk that comes along with it, given the group of population that includes. So given where we are right now, we feel comfortable that we can make this happen with those community partners. However, if you read the variance, it clearly states that at any point, if public health feels that numbers dictate that it's no longer safe, we can pull the plug on it. And part of the stipulation is every single school has to have a plan B, that if we feel it's not safe or the hospitals feel it's not safe and we pull the plug on it, they still go through like a virtual only graduation. So we've got a fail-safe built in there. And that's essentially similar to probably what we would have to do, because we're going to have to ask for restaurants to be open, obviously before the date that they would be open, right? There has to be a window to allow them to do that. And we would probably build in a similar statement about that, about, hey, this is the date that we're shooting for, but if we get to a couple days before and UC Health slammed and there's people stacked out the back and our doubling time is now a couple of days because we have failed in this opening, we'll have to be able to pull the plug on it. all events are not the same, right? That's simple to understand. Having a restaurant, a minimal opening to restaurant with 30% capacity is one thing. Having a rock concert or a Denver Broncos game where we've got thousands of people is a very different thing. So a lot of this comes down to risk reward. How much risk are we willing to tolerate? If this thing gets out of control, do we have the ability to deal with it? A high school graduation with young kids, all in mass, all socially distanced, we can take that risk because the upside is much bigger. A Denver Broncos game, today, there's zero chance that's worth the risk because there's no way we could control that containment if somebody showed up there sick and infected a bunch of people. The perfect example is our bridge tournament, right out of the gate. That's a great example. Terrible situation. You've got lots of people crammed in together, lots of high-risk individuals, and we saw the outcome of that. It was national media, how that affected our community and our hospital's capacity. So it's that constant weighing of risk versus benefit, how much you can control, what things can you put in place to mitigate the risk, and that's what we're working with, like with the churches and with the restaurants and with the library. If you can build in those fail-safes, there's an incredible amount we can do. Now, there's some things like, rock concerts, we're not going to do anything about for any amount of time, to be realistic. But there's a lot of things we can do leading up to that. And it's like anything. It's like any recovery. You get an injury, you have your surgery, you get done, you get up, you don't go and run a 40-yard dash, right? You test it, you push it a little bit, you see how it does. The next day you push it a little bit more. This is the same kind of approach. We just are at an advantage because we can push a little harder, I think, than the rest of Colorado because where we are and the capacity that we've built in. Any questions to that? Okay. So our local commitment and execution, obviously, of this phased approach that we've been super successful with gives us the opportunity to take some strategic approaches. Speaking directly to Commissioner Gonzalez's point, allow us to kind of get the biggest bang for our buck, and we've had those conversations amongst each other as well as with our partners in the EDC. But as we do that, we want to make sure, once again, that this is to Commissioner Waller's statement, you guys are under a lot of pressure. Everybody's making demands. We're in the same boat. We got half the people telling us we're moving too slow. We got the other half telling us we're moving too fast. And we're just trying to make the right decisions with the information that we have. But the reality is this is a partnership between the Board of County Commissioners, Public Health, and the hospitals. Not one of us can make a unilateral decision here that has any value at all. And that's probably a good thing. It's sort of the foundation of our democracy is checks and balances to make sure everybody feels good about where we're going so that one group doesn't suddenly, take over the conversation. These are medical decisions. You guys make political decisions. The hospital will make capacity decisions. And when you combine those three groups together, ultimately you're going to make really, really, really good choices. So Dr. Johnson, I believe, has some comments about how we're working with our community partners, the hospitals in particular, to make sure we're making sound, good decisions that everybody's on board with that ensures our safety, as well as pushes us forward down the road.
All right, before we get to Dr. Johnson, I always like to say Maslow's calling, so we are going to take a brief 5-minute comfort break so we can better concentrate on what she has to say. We'll stand in recess. The meeting will come back to order. All right, Dr. Johnson, I think, is where we left off here.
Good morning. Dr. Robin Johnson, Medical Director of El Paso County Public Health. Public Health routinely works with our healthcare and hospital partners. Their partnership and clinical expertise supports our community daily and is instrumental in supporting our community response to healthcare crisis. They were invaluable partners in our hepatitis A outbreak, which ended after 18 months on April 6th, so just 1 month ago. And they continue to be valued partners in El Paso County's ongoing response to COVID-19. Since the beginning of this pandemic, open and transparent communication has been present and ever more imperative with the complexities that are inherent in such unprecedented times. Given the importance of testing, and I'm going to pause for just a moment here to talk about the building of that capacity is only as good as we use it. So we are encouraging and really would appreciate help with getting the message out. If you have symptoms, get tested. And that is a place where you as commissioners could partner with us in getting that message. There are a list of testing sites that we are updating and keeping track of at elpasocountyhealth.org. And so if you call your PCP and that's not available, we certainly encourage you to look at that site. There are the mobile sites, and it is a moving target. There is, luckily at this point, increasing capacity and development, and there will be some other criteria that will be evolving, and we will continue to update that education so that our community can get tested and give us the tools that we need for that case investigation and targeted response. So given that that testing is so important and the hospital capacity is essential, we moved into the safer at home phase. As medical director, I have been in near daily conversations with the CEOs and CMOs of UC Health, Penrose St. Francis, and Children's Hospital. While they are unable to be present today for this discussion due to pre-existing commitments, they have expressed their permission for me to convey this information to you. Our hospital partners support the variance request for school graduations that is being presented by Dr. Kelly to you. Upon further discussion, however, additional variance requests will be reviewed for support as we have more data over time to support expanded openings. They are asking that we adhere to gradual phased approaches that utilize strategic, data-driven decisions with judicious implementation of any subsequent opens consistent with the CDC guidance. In addition to that, we are getting a regular schedule for review of variances so that it can be streamlined, it can be convenient and discussed in detail. They're asking that they be complete before they're presented to the hospitals so that there really would be an okay and not a lot of discussion to develop that. So the development will be coming from public health in coordination with our community. And so with this in mind, we're continuing to work with various community partners to facilitate the development of plans that fit their bandwidth and with our best public health practice for prevention. Our target is to have a final draft developed so that as our community data supports moving forward, we are poised to step into that moment. I know with this approach, we have the relationships and integrity to utilize collaborative understanding and eagerly await the appropriate intervals to move our community into the coming days. Public health and hospitals alike are committed to monitoring and analyzing our local data trends, and we will continue to work together to provide timely updates to you, to reassess and change course as needed. Thank you for your consideration and time this morning. We remain steadfast as public health in our objective to prevent, promote, and protect public health. We appreciate your continued support in this mission. Thank you.
Do we have any questions or comments for Dr. Johnson? Thank you, and thank you for all you continue to do. Dr. Kelly?
So I think that as we move forward, we've created a streamlined process. We're going to be working on these documents as we already have started throughout the week as we meet with these partners, our restaurants, our churches, and so forth. Those would be good opportunities that if you have areas where you would like to see some things done, that would be super helpful. I have my own thoughts. The Kelly family, our biggest thing is like on Fridays we go to the movies, and that may seem silly to most people. But like for us, it's one of those things that you just, it's like makes your family. The campgrounds is another one. We love to go camping, so selfishly, I'm like, yeah, we need to work on the campgrounds. But we're gonna do it smart. And if we have this system in place that we've talked through, the community can rest assured that for the folks that want us to move as fast as possible, we are doing everything we can to get us there safely and effectively. For the folks who think we're doing it too fast, we are moving together with all the partners, us, you guys, the hospitals, and And at no point are we going to risk losing the control of this thing. So the community can have absolute confidence that when we say it's time to go, it really, really is time to go. And so with that, one of the things we've identified that we really believe in strongly is a massive positive impact to the community with minimizing risk as long as we do it the right way. We've worked hand in hand with our local hospitals, our local schools, our superintendents, to create what we think is a meaningful and impactful experience for our students and their families and the broader community, but doing it in a way that every family should feel confident and safe in that process. And so we're going to move forward now to high school graduations.
All right, well, hang on. Let's finish up this this item. It's separate.
Yeah, you're right.
And so I just want to make sure I call them correctly.
Yeah, sounds good.
So let's do that. All right, do we have any other questions? Commissioner Bremer, anything on item 6A? Any other questions from the other commissioners on 6A? All right, so I will call up item number 9, resolution adopting an alternative plan for high school graduation ceremonies in support of a variance request under CDPHE Public Health Order 20-28.
All right, so we've worked really hard with our school partners to get something we think is important. The rationale that we've used for this, and I spoke to it a little bit already, is the graduations are they're a once-in-a-lifetime isolated event, a watershed moment in our young people's lives with huge emotional, social benefits for our youth, our families in our community. The participants of a graduation, by definition, are young people, 17 and 18-year-olds, that puts them in our absolutely lowest risk category, that if we do have some spread, we can almost guarantee, not entirely, but almost guarantee that those young people are going to do really well. We have the current healthcare and testing capacity to accommodate this minimal risk. It's a controlled, closed population. We know who all those kids are. We know where they come from. We have their family's phone number. We can identify all of them individually if something were to happen and do that contact tracing that we've talked about. We've been able to plan these events in coordination with public health, and we've had a previous approval from UC Health, Centura, and then Children's Hospital. So everybody bought in on the specific variants that we're applying for. And I think importantly, we already had a precedent set in our own backyard that was incredibly successful and very emotionally impactful at the Air Force Academy. And so based on all that, we felt like this was a good opportunity to leverage some of that good data that we have to make a big impact on our young people and our families' lives. And so the guidelines, which I'll post here in a second, but the gist of it is every school has to submit a written plan. You know, they have the guidelines to write the plan out of. Student and faculty will be only individuals at the ceremony. The crowd size restrictions are still in place, but we're having an exemption to that because we can control, once again, the participants in a safe way. They have to have an alternate virtual-only plan as a backup, or for families who just maybe aren't comfortable with that. Or, maybe the kid gets sick or dad gets sick or something and they think it's safer. They make a good personal choice to not be there. Parents, families, and friends will be present virtually, either from home or in their cars or however they want to do it. There's a lot of really creative ways that some of the schools are approaching this. There'll be outdoor only events able to accommodate class size. And so if you've got a small group, you don't need a big field. If you've got a large school, you'll have to spread all those kids out on the field or wherever you are. If you can't accommodate those with the space, you'll have to do it in shifts to make sure we can get that 6-foot social distancing. But every kid gets to participate. No touch diploma acceptance. Obviously, hugs and high fives are probably best left for the family at home. And then we're going to have some photos and those kinds of things. And you can take the mask off for the photos as long as you're being safe and being smart. If you want to have families come in various days with shifts and get family photos with the graduate, that would be totally workable as well. A lot of really creative ways you can do this. And then parents must provide, obviously, a written approval like any field trip. There's inherent risk in what the kids are doing, very, very low, obviously, based on what we've put forth. But we want to make sure the students and the families are informed about what's going on and to know that if they choose not to do this, they're going to have a good option for them too, so it can be a meaningful experience for them. Obviously, today we've put this proposal together. Here's the actual guidelines as written by me and approved by Dr. Johnson and Ms. Sego, and we're really happy with how this looks, and I believe Blake
Yeah, I'll take care of that.
Okay.
Make sure we have that whenever you're done.
Okay, and so, am I supposed to be stretching right now? Like,
No, you're fine.
ready to go?
Continue. Yeah,
We're on the phone?
he'll
So-
start calling in. I mean, and I do have a question/comment once you
Okay.
get to a stopping point.
Okay, we're going to have some comments from some of the superintendents. They have been immensely helpful. We have very diverse schools, from giant, massive schools like Cheyenne Mountain to very small rural schools, and we've worked with all of those various groups. We've got parochial schools, we've got private schools. Lots of meetings, lots of time, lots of energy went into creating this. It's not what necessarily those of us in this room had for high school graduation. But these are obviously unprecedented times, and we're making the most of what we've got here. And with that,
Yeah. So here's what I want to be a little bit cautious here. You know, you guys have done a great job putting this together, and you've done a tremendous job with working with the hospitals. Obviously, this is something we're going to support and approve today. But just to make sure everybody understands, right? This still has to go to the governor's office for approval, correct?
that is correct. This has to be approved by us, hospitals, you, then we send it to the governor for approval.
And so there's no guarantee that the governor's going to sign off on this in any way.
There's not.
In fact, we just saw some updated guidance from the governor. Do you want to go into that at all regarding high school graduations?
Yeah, so we've worked hard on this for 3 weeks, and last night, prior to presenting it here, the governor put out guidelines on what he thinks a high school graduation would look like. The good news is the vast majority of those guidelines are exactly what we have written here. Very makes sense, very sound. But we are still going beyond what the governor has said are his guidelines. But from our perspective, we feel like we've earned that with the data that we have locally and the infrastructure we've put in place. And so despite the fact that the governor has allowed some of the things that we want to do, we think it's still worth moving forward to apply for the variance, because we are confident that we have the ability to deal with it, and we're very confident in our school's ability to carry out what they want to give to these kids.
Good. Yeah, these seem to be, from the way I read it, and maybe I don't understand it completely, but it seemed to be going quite a bit further than what the governor's direction was, which I think is a great thing. It's where we need to be. Obviously, again, we've said it a million times. We understand how to do this better than in our community than somebody who doesn't live in our community.
Exactly right.
To include the governor of the state of Colorado. So hopefully, all of this hard work that's been put in is going to be submitted, and the governor's going to say, "Yep, you guys know what you're doing. We're going to allow you to do that," but maybe you won't. So hopefully that'll happen. Blake, do we have the next person ready to go? Okay. So and my understanding is we have superintendents of our participating schools or their representative. Is that correct?
I can answer that, Commissioner Waller, if I could, please.
Sure.
Diana May, County Attorney. We have 3 individuals that would like to address the board on this. The first speaker would be Dr. Walt Cooper, Superintendent of Cheyenne Mountain School District 12, and he's also the chair of the Pikes Peak Area Superintendent Association. After that, Tom Gregory, the superintendent for Academy District 20, would like to also lend his support and address the board. And then finally, Susan Payne, K through 12 School District Higher Education Liaison to ECC, and also Cheyenne Mountain School District Security. And so we do have 3 speakers. Blake will have to call them after the next speaker's done. He will then have to call the next one, but they are all 3 available and would like to address the board, please.
Got it. Thank you. Blake, who do we have on the line? All 3 of them. Dr. Cooper, if you can hear us, please state your name and then you may begin.
Thank you, Blake. Thank you, commissioners. Is my audio coming through okay?
Yep, we got you loud and clear.
Perfect. This is Walt Cooper. I'm superintendent of schools for Cheyenne Mountain School District, and as Diana indicated, I also am the current chair of the Pikes Peak Area Superintendents Association, which represents all 15 school districts in El Paso County. And first and foremost, I want to thank all of the staff at El Paso County Public Health and the county attorney's office who have worked over the last 3 weeks or so on this issue of high school graduations. Once we received indication from the governor that local considerations would be reviewed through the waiver process, Literally on that day that we received that notification, Dr. Kelly and Diana May began consulting with us. And in the days since then, we've had a number of remote conferences and phone calls and correspondence among all superintendents in the county, and have expanded these conversations to include our colleagues in the private and independent schools in the county, among charter school leaders in the county, Colorado School for Deaf and Blind, and so on. And so while you might imagine that there were varying priorities and proposals among the districts that were involved, there was widespread agreement, I'd say unanimous agreement, that our top priority, our first objective, was to be able to honor our seniors in a ceremony in a way that was as meaningful and as memorable to them as possible, understanding that obviously our traditional graduations would not be allowed, so we were looking to something as close to normal as we possibly could get, and then beyond that, anything else that we would be allowed to do safely would be of greater benefit. But we also realized that whatever we do must be done in a medically and socially responsible manner, and to that end, we really appreciate the attention given to this issue by Dr. Kelly and the hospital officials in the county, and trying to navigate this in the best manner to achieve our objective, rather than just saying no, which obviously would have been the easiest approach. But even though the guidelines and the approach that we're taking now is far from what we all expected 2020 commencement exercises to look like, the guidance presented today will allow us to honor our graduates in a manner that we believe is safe, it's responsible, and most important to them is memorable, and certainly puts us in a much better place than where we were just a few weeks ago when we thought that really no ceremonies of any kind would be allowed, which was, I think we would all agree, was really a tragedy in terms of our ability to recognize our kids. So with that, I encourage and appreciate the Commission's support of this approach, and I'm happy to either defer to comments from our other representatives or answer any questions that you might have of me. So thank you, Mr. Chairman.
Thank you, Dr. Cooper. Thank you for all you're doing to make sure the high school seniors in District 20 are getting the best opportunity they can have. I'll tell you, as a father of a junior in District 20, we certainly appreciate all you're doing. All right, Mr. Gregory?
Yes, can you hear me?
I got you loud and clear. Please go ahead.
I'll get that question from every speaker. But so my name is Tom Gregory, Superintendent of Schools, Academy District 20. Dr. Cooper spoke kind of on behalf of the Pikes Peak Regional School Districts. I'll speak more directly towards our community and Academy District 20. When this all started, we actually asked parents and students for inputs on what would be meaningful to them. And wasn't a survey to fill out. It required folks to actually log in and to a system, so there was a little bit of effort required. We thought over 400 responses, forms of input were important and sufficient, and it was overwhelmingly clear that our community desires not only something that's meaningful, but something that, if possible, includes in-person settings. Something like the Air Force Academy is what I heard a lot of, because this survey went out after the Air Force Academy's graduation, but certainly was very clear that even if it was graduates only, there was ways to make that work. We feel that we can make that work within the guidelines, and it's what our community wants. I don't want to speak for other districts, but I know that there are several other districts where the response was very similar to what ours was. And with that, I would also like to essentially applaud Dr. Kelly, Ms. May, Susan Payne, and the commissioners for the approach to exercising the opportunity for a waiver. In many ways, the Pikes Peak area Pikes Peak regional superintendents and their school districts and communities many times lead educationally the Pikes Peak area. And I think this is a chance for El Paso County to lead in the area of this waiver issue with other local counties. There are school districts in our region that are in other counties, and my sense is that they're hoping their counties kind of do the same thing that El Paso County is trying to do. So I applaud all the folks involved, and I know that I'll pick on Dr. Kelly especially, that he has gone above board to get input, made himself available multiple times for video conferencing with the entire region of superintendents inside and outside of El Paso County, whoever wanted to listen. And I think shows incredible leadership and foresight for the county to represent the commissioners to represent its citizens and do its best for what we think is best, at least for the students, the seniors, and their parents of El Paso County. With that, I'd be happy to answer any questions also.
Thank you. And is it Dr. Gregory? Did I misspeak earlier?
It is not. It is clearly Mr. Gregory.
Okay. I just want to make sure I'm doing this correctly. I guess I should have waited to thank you for all you're doing as well, and thanks for all you're doing for the D20 kids and parents there. Again, as the parent of a D20 junior in high school, I certainly appreciate all you're doing for our kids.
Thank you very much. Trying to do the best we can.
Absolutely. Do we have Ms. Payne on the line as well?
Yes, thank you, Commissioner Waller. This is Susan Payne. Can you hear me okay?
Yeah, we got you just fine.
Thank you. Just a little history to take you back. I think the demographics of our county and schools is that uniquely our county has the largest number of school districts with 15. Additional to that, we have the Colorado Springs Deaf and Blind School locally. We have the Board of Cooperative Education Services with the BOCES, and a large number of charter schools, private schools, and faith-based institutions. I want to thank Director Wheelan for the decision that we needed to have somebody as a liaison to coordinate with all of the local districts in higher education in order to work in a spirit of collaboration and partnership. As far as the school leadership, it has been impressive. Our goal has and always will be to protect the safety, health, and wellness of our students, staff, and families. We value our strength as a community. It is our greatest asset. In making the decision to close schools, we were the first to close in-person learning. And really, it was out of an abundance of caution and with a focus on prevention. The belief of the superintendents was that there was a strong, urgent action that spread of this disease and to protect the lives in our community. I think that early decision-making and the coordination with public health, Dr. Kelly, County Attorney Diana May, and really all of the people in the ECC that are working together to provide and gather information so that we can make informed decisions has been critical. The success of building this ship, I think has been mentioned before, is to build a more robust collaboration and partnership with schools, and to understand that the significant component to our infrastructure involves schools, their ability to assist in crisis management and response. With that, I want to say that many of the school districts that have been afforded the opportunity to be on direct meetings with Kelly, Diana May, and public health have been instrumental in understanding the plan for the opportunity to celebrate the class of 2020, which is a very unique one, and to make sure that we're doing it in coordination as a county and in our different municipalities. There are a variety of plans that everyone has worked very hard to develop, but I do want to say that in communication last night with the Deaf and Blind School, this morning with all the rural superintendents, everyone is in support of county for a variance to be submitted to the state. So I just want to thank everyone for their work on this, and we really are honored to work together.
All right, thank you, Ms. Payne. Are there any questions, comments for Ms. Payne? Okay, anything further?
That's all we got.
All right, I'll bring it up to the dais for deliberation and a vote. Any questions, any deliberation? Let's start it off with Commissioner Gonzalez.
Thank you, Mr. Chair. I'm very supportive of this. I think there's been a lot of research. Again, I think the research that's been done for this, is relevant and valid for a lot of what we're looking for on the second variance request as well. So I'm hoping that helps our process there as well for timeliness. It is one of the few things. I did get interviewed when they said they were canceling the graduation, but for parents for the Air Force Academy, and because that was a very big deal. And so just as similar to the high school graduates, that was a big deal for everybody. And so it's something that we really want to do as best possible in these situations, give the students that opportunity at one of their, one of the real greatest memories that they're going to have and move forward. And we want to make sure we preserve some of that as best possible. And so something I'm looking forward to. In general, I appreciate the process, the timeliness. Again, I don't want to keep reiterating, but for continuity of discussion purposes, the outline here is that none of these graduations can occur for at least 3 weeks, because that's the process way ahead. So we are approving a variance request today for the governor to approve or not approve for something that will take several days of approval at the state level for something that will then be 3 weeks. So we can approve a variance submission request early, add conditions, even if it's a week, 2 weeks, 3 weeks later. My concern is on the second variance request, if we wait, we're never going to get to the variance request. And so here's a process where we're essentially waiting the earliest graduation request 4 weeks out, and we're approving that today. And I'm approving this. I'm supportive of it, but I just want to put that as something I think that helps us speed up on the other one as well. Thank you.
Commissioner VanderWerf.
Thank you, Mr. Chair. I will be supporting this as well. I appreciate all the hard work that everybody's done to put this together. I have to imagine, I guess perhaps in particular because this is the first variance request, there was a lot of starting and stopping and figuring out how to do it and trying to figure out how to get everybody on board. I will make the point that, I think if I heard you correctly, Dr. Kelly, this took 3 weeks to get to. It's just my firm belief we've got to figure out how to go faster than that for the future variances because of the economic harm that continues to take place. So that's one of my interests or recommendations for the team to consider how to get to these things more quickly because of the economic downside side of this. But I am very appreciative of this one, that we've got it. I think I did see in here, and maybe you can clarify this. Does it say something in the document about each of the school districts must submit a plan and they must do it 3 weeks in advance of when they would hold the graduation? Because if that is what I heard right, that seems like a long time as well. And I mean, we're kind of like lead time out for a lot of the schools right now.
It does. Yeah, so it does say the plan. We have a lot of plans already.
Oh, you do have them already?
We do.
Oh, okay.
Yeah, a lot of them. As we went through this, I had drafts of this document out probably 2 weeks ago to schools, so it gave them time to work on it. So we've already got, most of the schools already had, because they had the guidance from us, they already knew what was going on.
Okay.
So we're in good shape, yeah.
So that's good to hear. That makes me feel a little bit better about that requirement. But again, that kind of speaks to the same concept about the need to go quickly with these things. And going quickly doesn't necessarily mean you're going to get to a place where you will submit one of these for approval to the board, because you may have somebody in that identified process that's objecting, right? So it's still a negotiation, but we've got to figure out how to make that negotiation go as fast as we quickly can. Not to necessarily try to use this as an analogy, but when you're in a crisis, things should not happen in weeks. They should happen in days or maybe even in hours. And that doesn't mean I know how to tell you how to make it go in hours, but that's the kind of thinking that I think we've got to pay some attention to. Having said that, I will support what's in this. I don't know how this is going to interact with the governor's release that just took place. I hope that I hope they don't reject this and tell us to go back and redesign, because, you know, when nobody knows when the state is going to issue something and we work on this for 3 weeks, I sure hope they don't tell us to go back and start over. So hopefully they'll take what they've allowed, what the variance is that's in here to that, and approve that. So I hope that's what they do. Thank you.
Commissioner Brimmer.
Thank you, Mr. Chair. You know, this is a beautiful example of so many different entities coming together and realizing what we can do. So much of the focus has been throughout this on what we can't do. And this is a great example of applying the medical knowledge that we do have, the trending knowledge that we do have about how this virus is acting in our community, and combine it all with a really practical resolution. So with that, I want to thank all 15 of those school districts who kind of came to the table, all 3 hospitals, and of course our health department staff. You know, with that, I move approval of this waiver.
Thank you. And before I ask for a second, I'm going to make my comments now. Appreciate all you all have done to make sure this happens. I think it's incredibly important for, you know, just some normalcy for families and their lives moving forward. I mean, goodness sakes, it's a graduation, and you're right, it's a population that can handle this, and you come up with a great plan to make sure it can be handled correctly. And appreciate all the effort that was put into that. Obviously, this is a complete no-brainer in terms of support. You know, it's something that I don't think it's just something that actually would be nice to have happen. I think it's something that needs to happen, and hopefully it will be a precursor for us being able to do other things moving forward as well. And hopefully, you know, the governor is going to understand that we feel that we can do this better in our county and is going to approve it. So, with that, could I have a second, please?
I'll second.
That's been moved and seconded. I will call the roll. Commissioner Brimmer.
Aye.
Commissioner VanderWerf.
Aye.
Commissioner Gonzalez.
Aye.
The chair votes aye. That passes unanimously with Commissioner Williams excused. Thank you.
Thank you.